Have you wondered if you or somebody you know should consider dental implants and what your options are? Well, that's what we're going to cover in this program. What an implant is and some of the factors to consider. I'm Dr. Michael Miyasaki, and my daughter and I, we practice in Sacramento, California at Mi- So what is a dental implant and what's needed if you're considering having a dental implant placed? Well, a dental implant is what we see over here. And so basically, this represents the gum, the bone, and inside the bone, we place an implant. That implant sits in the bone like your natural root would sit in the bone. And once that implant heals in the bone, then we put a crown on top, which is basically the tooth replacement. Because the aesthetically, it's not going to look good if we place an implant, so it's something that you have to consider. And if there's any systemic diseases and they're an uncontrolled diabetic, that the bone and the gum won't heal up well. So if you are a diabetic, discuss that very seriously. If you're a smoker, if you grind your teeth, or if you have just poor oral hygiene, these are some of the reasons why an implant may not heal up well. Any pressure being placed in that bone, so just like a muscle, it gets smaller. When you place an implant in that area, the bone stays stronger, it stays wider, it stays higher, which is good. Down, we call that extrusion. And eventually you could even start biting the gum on the lower jaw because the top tooth drips down so much. If you miss a tooth, it's harder to eat. It's harder to speak because air passes through that space. And aesthetically, depending on where that tooth is, when you smile, people might see that space. So one of the big things about having implants is it gives you so much more confidence. Now, if you have dentures, one of the things you worry about when you have dentures is your dentures falling out. You know, we see that many times on YouTube or in commercials where somebody who has dentures is speaking or eating and they bite into something and their dentures stay stuck to that food and they open their mouth up and their dentures pop out. Well, sometimes we can place implants and then secure the denture to the implant. So again, it gives you more confidence. And what research even shows is that the more teeth you have, the longer you live, which gives you more years. And who doesn't want to live more years? And the reason why is because when you have teeth, you're able to eat better. You have a better diet. People that don't have teeth typically are eating a softer diet. They don't get the roughage and they don't get all the other good nutrients from foods. The better you can chew your food, the better your body's able to extract those nutrients as that food goes through your digestive system. If you're able to smile, eat better, speak better, you're going to be more confident, you're going to be happier. And because you're happier, you're going to live longer. So really, the benefits are almost priceless. If you can have a dental implant to replace a tooth, then often that's what we recommend. And that's what makes an implant so advantageous. We don't have to work on teeth in front or in back of that space. We don't have to worry about it falling out. We don't have to worry about teeth shifting around. An implant, in many cases when you're missing teeth, is one of the best options. So here's a dental implant that's been placed where you see the silver, that's the dental implant. It's going through the gum into the bone. And once this heals up, we then place our crown. And you can see this is the crown right there. This is a natural tooth, and here's another crown. And it's an older crown. And if you look at the color, the patient eventually wants to go with a lighter color. That's why this crown's a little bit lighter in color. But the thing I like about this is that being lighter in color, you can tell that this is the implant crown, and you can see how healthy the tissue looks around that area. And this implant was placed a few years ago, and it still looks the same today. So this was the dental implant placed with a minimally invasive approach. We did not make many incisions. We just placed this implant through a little opening in the gum into the bone. It healed up. Then we put the crown on there. And now this patient has a fully functional restoration that I think aesthetically is pleasing. They can eat, they can chew, they can speak, and again, with confidence. So if you want to look at the possibilities of you having an implant, then give us a call at Miyasaki Dental, where really advanced science meets compassionate care. So if you'd like more information about dental implants, give us a call, and we'd be glad to answer any questions that you have. Thank you very much.